Mom, don't come to the parent-teacher meeting. So this is what you hear when you are entering your kid's bedroom. And suddenly you get shocked. Why is your child shouting, um, asking you to not come for the parent-teacher meeting? Your heart sinks, you're sad, and you're also shocked. But you want to know what's going on. So you ask your child, um, what's the problem? Is there a problem at school? Is the teachers are not happy? Are they going to complain? So you try to pacify your child. And then you find that your child shouts again and says, Mom, don't come to the parent teacher meeting because all my friends tease me because you're too fat. So this is what I hear from my patients. I'm Dr. Rajeshwar, consultant endocrinologist and bariatric physician. So when I consult my patients, especially those who come for weight management, I ask them, what's your motivation? So the lots of people say, look, I want to look good. I want to go on a holiday. I want to get rid of my diabetes, or I'm planning for a surgery. So I need to lose some weight. So these are the usual reasons. But then over the last few months, I've been listening to a different sort of motivation. That's the kid telling them not to come to the parent teacher meeting, which I felt was very sad. By the way, I don't use the word fat. I tell my colleagues, my juniors, dietitians, the whole team in my center, none of them use the word fat. We either say elevated body mass index or people with obesity. I think that's more a polite way of saying it. So let me start. So what I'm going to do is, it's a very serious topic, which is going to go very worldwide. And people don't talk about this particular topic because they're shy or they don't know what to do. So it's all about the impact of parental obesity on children, on the children's confidence, on their education and their future. So it's a serious topic. So I'm going to talk to you about my experiences in dealing with this group of people in the UK, India, and those who come from United States to come and see me, because they all mentioned this particular problem. So as you all know that being overweight or obesity is being discriminated. So I want to talk to you briefly about obesity discrimination and weight bias. I'm going to talk to you about statistics, and but most importantly, I'll be talking to you about what we can do about it. And that's the key. So let's look at the scale of the problem. So if you look at England, nearly 3/4 of the population are either obese or overweight. That's staggering. But in the United States, it's worse than that. In fact, people are starting to accept it, and they're going to the brunt of obesity and being overweight. So you need to understand, it's not just about being big, it affects your health. Type 2 diabetes, hypertension, stroke, cirrhosis of the liver, cancers, arthritis, and then depression, social isolation, going off sick. So there's huge impact of obesity on someone's physical and mental health. But no one talks about the impact on the kids. And that's what I'm going to focus on today. So those of you who are affected, or those who know you who are affected, please do share this video because it's an important topic. We all need to stand up to this. So what I see is, before that, let me tell about India. India is rapidly developing, and a significant proportion of people in the urban areas are affluent, and obesity levels are touching 40%, which is massive. And there are huge number of people with normal weight obesity. So that means they look slim, but the fat percentage is high. So obesity levels in India is much more than what is documented in the research papers. And the worst bit are the southern states in India, that is including Karnataka, Tamil Nadu, Kerala, and Andhra Pradesh, Telangana. where the obesity levels are much more than the north of the country. If we have talked about the statistics, but which group of people are affected? It's usually between 25 to 45. That's the group who have kids at school. But sadly, that's the group heavily being affected with obesity and overweight. So why is that? That's because there's change in lifestyle. There is career pressures. That's the age when you're working hard to try and get to the next level of your job, getting promotions, trying to improve your financial status. So that's one of the reasons. So lifestyle changes, career pressures, and parenting responsibilities. But then we also neglect something called post pregnancy weight gain. And that's very important. Postpartum weight retention is a strong predictor of obesity in later life, which can significantly impact your health. So women gain excessive amount of weight after pregnancy. I'm not trying to generalize, but most women do gain weight and some work very hard to get it down. But some struggle for no fault of theirs because they're so busy, and some have postpartum depression, which again does not. So post pregnancy weight gain is common, but men are not spared. Fathers can also experience sympathy weight gain, which can persist long after childbirth. Discrimination is rampant. In fact, I have read somewhere that obesity is the most discriminated condition in the world now. People who are overweight and obese get discriminated at the workplace. You find that they are not promoted and they don't get opportunities. They're not able to travel widely as their partners or the colleagues. So you'll find that this is rampant. The discrimination is rampant. So this gets trickled down to the kids as well. So one of our patients recently mentioned that she dreaded every time there was a parent teacher meeting or the parents evening. So she would say that, oh, it was not because of the daughter's grades, but because I knew I would struggle with those tiny chairs in the classroom. As you know, that parent teachers meeting can sometimes be held in a classroom, and if it's a primary school, the chairs are small, and no one's bothered about how the parents are going to sit. So this particular patient was scared of even going to these parents' evening. And she was also scared that she could be judged based on her looks, and this would have a significant impact on her child's academic outcomes. So I thought that was very sad. And this is why I wanted to do this video so that it's the awareness is increased, not just with the parents, but with the school teachers, the management, the society at large, and even the doctors. A lot of my colleagues don't appreciate this serious problem. Okay, so this is very systemic. This discrimination is systemic. The society is not helping, and our movies are not at all helping. Both the Hollywood and Bollywood, they don't help, and they try to portray people with obesity, and they make jokes, and this trickles down to the kid. They feel ashamed. The kids feel ashamed, but they don't articulate. So the impact of adult obesity and the discrimination has a ripple effect on the kids. So that leads to discrimination even amongst school kids. So what happens is there was a research, they looked at um, how kids behave with other obese children. And in fact, they found out that if they had an option, 50% of the kids would not choose a obese kid for any form of activity. So that means if there's a sporting event, they would not choose an obese kid. So as you can see that discrimination starts right at the bottom in school. And you can imagine what the teachers do. I mean, I'm sure teachers are also culprits in this. So when a child sees a parent being discriminated or hears that the parent is discriminated, you know what? They internalize their experiences. They don't let it out. They internalize it and they start to think that people are judged by their appearance. So child starts to grow thinking that it's all about your appearance and people will judge you. So there's a shame, there's a guilt among the kids, and they don't articulate it. But the fact is, you find that the academic outcomes, they don't score well, they go downhill, they don't socialize, they're not good at sports. So that has a significant impact. And they feel embarrassed. They don't even communicate with their parents or teachers to say, this is the problem. And this is the reason that I brought this video out, that it has to be spoken out loudly and at every place, in schools, in forums, in communities, in movies. We need to start killing this discrimination, which is quite rampant, affecting our kids. So, what can we do? I think we need to start from the school. It should be the school, the management, and the teachers. So, the school, they should educate the kids to say that, look, obesity is a condition, it's a disease for no fault of that. For example, it's just like diabetes. Would you discriminate someone who has got diabetes? Would you discriminate someone who has got high blood pressure? You can't say, oh, they've got high sugars. You can't do that. And no one does that. So that's exactly, obesity is a disease. So you can't discriminate someone because they've got a disease. And that's the education we need to pass it on to the kids, first to the teachers and then to the kids. And people should deal with obese parents and obese kids in a more polite and a sensitive way. They need to use the right words. There should be appropriate furniture in the school, and the corridor should be good. They should be accessible. There should be accessible parking lots closer to the entrance. And what I notice is these meetings can sometimes take place in a classroom, and sometimes the classroom is on the fifth floor and there's no elevators, no lifts. So the parents struggle. So planning is the key, both for the parents and the school and the teachers. So before a parent-teacher meeting, they should inform, the teacher should inform the parents where the meeting is done, what facilities are available, where is the parking lot, and how they can easily approach the venue. Similarly, parents should also call and find out what facilities are available. If they can't attend it, they should say, look, I would rather have an online meeting. So they should be outright and open and make sure that they express their feelings rather than skip a parent-teacher meeting. So basically, it should start with education of the kids, to say that if someone is obese or overweight, it's no fault of theirs. It's a medical condition. And that's the starting point. And this should be in the form of formal education and also as part of casual talk. It's very, very important. And there should be some anti-discrimination policies in school. And in fact, it should become even legal not to discriminate people with weight problem. I strongly feel about that obese people should not be discriminated, and people who discriminate should be charged. So I think it will happen if we all start talking about it. This will happen. Just like, for example, smoking. When people were smoking 30, 40 years ago, they would smoke inside the school, they would smoke in the offices, they would smoke in the living rooms, and no one thought it was bad. But slowly things have changed. We don't like people smoking inside the house. So things will change. If you're all aware and if you can pass on, discuss it openly, this will change and we'll be more kind. So I feel that every parent deserves to feel welcome and respected in the child's school through their policies, through school's awareness, and there should be a genuine inclusion. We need to create an environment for families which can thrive. But for the parents, I would say that it's not the number, on the weighing scale, which you identify with, but it's the love and support you give your child. And that's the key. It's the love and support you give your child. So you need to also change. You need to feel that you've got a medical condition which is going to get sorted out. You're going to seek help, and you need to be confident in front of the kid. That's the starting point as far as parents are concerned. And you need to also understand that you're not alone in this journey. Hope I've made my point, as I'm very passionate about this particular point as my patients suffer. I want this to be widely circulated, and I'm happy to answer any questions if someone wants to hear my opinion or wants some ideas or some, because I've worked with schools to improve the relationship with parents, especially those with obesity. So I am happy to help.